Welcome to Napa Valley Inside Out. I'm Latife Hayson, and I am delighted to be hosting this podcast, shining a light on one of the most beautiful and coveted lifestyles in the world. If you're interested in developing a property, planting a vegetable garden, making olive oil, fashion, architecture, interior design, county rules and regulations, biking paths, art, getting into the wine business, farming practices, the tax benefits of owning a vineyard, or the ultimate private tours and tastings, and all the fabulous annual cultural events we enjoy here, and so much more, then you won't want to miss this show. Every week I will be interviewing amazing talent, vintners, entrepreneurs, leaders, consultants, event planners, and more. They will share their knowledge, experience, advice, goals, passions, and their best kept secrets. Hello everybody, welcome back. Today I am delighted to introduce you to Dr. Gan Dunnington, Cardiothoracic Surgeon at St. Helena Hospital. He has a particular interest in minimally invasive cardiac and thoracic surgery and has become nationally known for his work in arrhythmia surgery. Thank you so much for being here.
Thanks, Latife. It's my honor.
It's been a long time. I remember the first time I met you was in Oakville.
That's right.
At a vineyard with a little farmhouse owned by Barbara and Mike Oliver. Mm-hmm. And that was long before you moved here. So you moved here in 2013.
That was a beautiful property. I remember when we moved here, right, 2013. We looked at a lot of properties together, didn't we?
We did. We had a lot of fun.
We did have a lot of fun. They were big and small. There were some had vineyards, some didn't have vineyards, and I thought the best part of it was really the last property that we saw. That I think we were sold on another property right over there off Ehlers Lane.
Do you remember
that I was excited about, and we went and saw this last one that it really has become a dream property for us. It's just been perfect.
That was really...
We owe all that to you.
Oh, no. Actually, that was one of those ones that'll go down in my memoirs. Honestly, that was fantastic because I was so grateful that you didn't fire me. Do you remember we went to that house 5 times that you loved? You loved it. I'm like, I'm begging you not to buy this.
You did.
Do you remember?
You did, absolutely. And you were completely right. I mean, I can't even imagine it. I'm sure we probably would have already moved by now if we had bought it. There was a lot of charm. I loved the house, but it wasn't anything like what we ended up with.
Oh, my goodness.
Just goes to show, a little patience pays off.
And it's on the market again. Yes.
Yeah.
Right on Silverado Trail.
It's gone on and off a couple times, I think.
Yeah. So you are married to the lovely Bridget and have 3 children.
Lucky guy.
Lucky guy. It's true.
That's right. With little kids. So Bridget, obviously, is my wife, and we've been married since basically college. We got married right after college in 96, and then Ella and Biggie and Reagan. Those are the 3 kids. So
yeah. And since I've seen you, you have gone from 3 dogs to 8.
Yeah,
tell me about the dogs.
Funny thing how that happens, right? we actually had 4 dogs. One of them was a little pup, and 3 of them all kind of died. 2 of them expectedly. They were old, 17 and 15. One of them unexpectedly. And so then Bridget, she needs to have more dogs. She says, well, I want to go look at a lab. I say, yeah, sure. Go have a look. She comes home with 2. I said, okay, well, we're back up to 3. That's manageable. I know that. And she, I'm going to go help a friend find another dog. Comes back with 1 for herself. So now we're back up to a full, I think a quota of 4. And then next thing you know, we start breeding labs. And every time you have a litter, it's hard to resist those little guys. So yeah, we're up to 8 and counting, I suppose. The other day, in fact, I think my kids started a chant of 2 more dogs. So who knows? Who knows how far it'll go.
And on your property, you don't have to run them, right? Because they just run. They just take off.
We have some acreage, and they're kind of inside outside. They like hanging around the pool, and to be honest with you, they keep things like critters away. Possums and raccoons and rattlesnakes.
Yeah,
we don't have to worry about them. Definitely no deer. So it's, in fact, my wife's license plate is Dog Farm. So
I remember I think I gave you Christmas card stationery. It was called The Farm at Meadowwood.
That's
right.
I love
it.
Right.
It's such
that's
a great
right.
property.
Yeah, we're not exactly farmers, but we live on a farm.
Yeah, it's awesome. Tell us about the road. You were born and raised in Virginia.
Sure.
Tell us about your road to Napa Valley. I know when I met you, you were living in Los Altos and you were on the faculty at Stanford.
Right.
And you had a little home, which you still have in Yountville.
Right.
And that's where you would come on the weekends.
Right, yeah, Yountville was really kind of the beacon for us. That's what really drew us up here initially. But I grew up in Virginia, and Bridget and I met at Duke for undergrad, and so somehow the California girl went out to North Carolina for college. I still can't figure out how that ever happened, but we became kind of glued to each other early on, and moved back out to California for a year, and then it was back to Virginia for medical school at Medical College of Virginia I was really there for 6 years. I had med school and a couple years of residency, and then it was back to Stanford where I did my general surgery residency, and back to University of Virginia for cardiac surgery. So all this time we kind of knew we were coastal people, West Coast or East Coast. And I think we slowly but surely realized we were more Californians. I mean, Bridget was always a Californian,
yes,
but I quickly realized that there was a lot of advantages, and just, I like the lifestyle out here. So we moved out, and I took that job at Stanford, and we were living in the Bay Area, and it was natural. It was next to Bridget's family, so her parents are here, her sister's there, and I was working not too far down the street at Stanford, and it was nice. But we bought this little place in Yountville, and we would come up every other week or so, and I think every time we'd drive home, we'd think, man, wouldn't it be nice if we could stay?
Everybody has the same feeling, yeah.
What about the concept of actually, living and making a life up here? And as it turned out, I didn't really know much about heart surgery up in Napa Valley at that point. As it turned out, there was a pretty rich tradition. St. Helena Hospital had been doing heart surgery since the 70s. Had a hospital that was really kind of in a process of a changeover generationally. You had a lot of senior physicians that were starting to retire, that had come out of Loma Linda primarily, and there was this big overhaul of doctors as a younger generation that were mostly Stanford, UCSF, maybe UC Davis. Some real high-end, high-level educated doctors were coming in, and specialists, and I thought, that's maybe something to look into.
Yeah, I remember that. But you had a great mentor, I recall, in Virginia, yes?
Yeah, so Irv Crone was my cardiac surgery chief, and he was one of a kind. I mean, he was the type of guy that really he just spent a lot of time with us. So we learned a lot. I mean, at UVA, I happened to be there. I've always been the product of the right place at the right time, and so
the guardian angel.
That's exactly right. And so I feel like even at Stanford for general surgery or UVA for cardiac, these were programs that I think I just happened to be there when they were at their peak, the golden years. So I felt really good coming out of training, and this is 2010, whereas these days a lot of cardiac surgeons coming out, they need a few more years of extra training and whatnot. So I got lucky enough to come to Stanford, where I also had Bobby Robbins was my chief there, and really has kind of helped me build a career early on also. And I just so happened to stumble into this arrhythmia and minimally invasive arena, where I don't think I ever would have learned it if I hadn't had the combination of UVA and Stanford. It really is.
Interesting.
It's crazy
Yeah.
how
I remember
how it
you
happens.
saying that, actually. Yeah. Oh, so how many doctors are doing minimal invasive surgery in the country, in US?
Nationally, it's hard to kind of put a number on it. I mean, when I think about cardiac surgeons, I think there are fewer cardiac surgeons that come out every year than, say, guys that go into the NFL, right? And in the cardiac surgery world, more younger doctors coming out are trying to or learning to do minimally invasive surgery. More older physicians either never were trained on it, don't want to start it, or they're kind of more just riding out their last few years. They're within Northern California. If they're 40, 50 cardiac surgeons in all of Northern California, there's only 3 or 4 that really do a significant amount of minimally invasive work. And that can include robotic work, which I used to do some robotics, and we don't have a robot at St. Helena, and I haven't really done it much up here. I don't think it makes a big difference. But really, when we say minimally invasive surgery, we just mean you're not having a full sternotomy. You're not having a full open cracked chest. You get small keyhole incisions, which makes a big difference for patients being able to recover faster, get back to their their life. Instead of a 2 or 3 month process, it can be a few week process. With that said, if you're 50 years old and you're going to live another 30 or 40 years, 2 months in your overall life isn't necessarily a deal breaker, for everyone. Everybody loves the idea of a small incision.
Of course.
But what's really most important is that you get the best possible operation that you can get.
Right.
And so you want something that's going to be durable, it's going to last, because most people never want to have more than one heart surgery in their life, even though some others are doomed to have a few.
Right. So the minimally invasive surgery obviously can't address everything.
Right, exactly. So if you have to have a combination, in fact, like the operation I did this morning, the guy needed a valve work, he needed AFib work, he needed bypass work, he needed an ascending aorta. All of those things can't be done just through a keyhole. But if you need just a mitral valve or a mitral tricuspid valve or an isolated aortic valve or just atrial fibrillation, any isolated problem, maybe other than bypass, which is one of the more common things we do through a sternotomy, other isolated problems can almost all be addressed minimally invasively. When you start putting together 2, 3, 4 issues that need to be dealt with, then when heart surgery, there's a lot that goes into speed. I mean, there's a lot of importance around speed and efficiency of the operation. So I think everybody is a snowflake, right? And we have to kind of treat everyone like an individual. So not everybody that wants to get minimally invasive surgery is a good candidate for it. Other people think, oh my God, heart surgery, how is life ever going to be the same? And they realize, oh, it doesn't necessarily have to be as bad as they thought it would be.
Right, yeah. So where are you finding most of your patients are coming from?
Well, that's an interesting question. If you look at St. Helena as a town, it's a population of, 5,000? Yeah, something like that.
Part-time.
Right.
I mean, there's half of them are only there part-time.
Right,
Yeah.
and if you look at the population of people that need to have heart surgery or say arrhythmia surgery, which is one of my specialties, it may only be a couple percent, a few percent. So you start narrowing down the numbers. It's pretty small. If we only drew from St. Helena or even Napa Valley, there'd be no business at all, right? Right. So we actually draw from all over Northern California. We have a large population that comes from, Eureka, Redding, even Sacramento area, certainly over towards, Santa Rosa, down in Napa. And then for specific services, the atrial fibrillation is the thing that, I've kind of carved out a specialized niche for. We've had people come from several states. So people will travel for services if it's not locally available.
And so are there many doctors doing that, arrhythmia surgery?
No, to be honest with you, that's, if I say, not a whole lot of cardiac surgeons are doing minimally invasive, almost none are doing the arrhythmia surgery. So when I moved up here, that was really one of my focuses. I wanted to develop an atrial fibrillation center because while I was doing it down at Stanford, I didn't necessarily need to be at Stanford. There's a big population around there, but this, AFib is one of those things that is very, very common. And it's very elective. It's not like you walk in and you die from atrial fibrillation. You have to have an emergency AFib operation.
Right.
That doesn't happen. So I knew if we could set up shop in a nice place where people would be willing to travel to that had good cardiac surgery services and excellent nursing kind of facilities all lined up, that we could get people to travel from anywhere. I mean, I got a patient coming from Virginia in a month. So I've had people from over the country, and that's because truly with arrhythmia surgery, I mean, there aren't more than probably 20 surgeons in the country that do any real considerable volume. Maybe, and that may be generous, could be even less.
Now, why is that?
It's one of those things where arrhythmia surgery isn't probably as sexy as some of the other heart surgeries. Some people like big aortic surgery or valve surgery. And when you're a heart surgeon, the arrhythmia stuff, even in the cardiology side, there's a whole specialized group of cardiologists called electrophysiologists. When you think of cardiologists, you think of somebody that listens to your heart, maybe looks at an echo, and then usually think about the guys that put stents in, right? Electrophysiologists have always dealt with the electrical system of the heart, and it's always seemed a little bit more complex, like nerdy to some degree.
Right.
Well, surgeons, especially heart surgeons, haven't necessarily been in the business of getting into the nerdy side or the sciencey side. Again, it was one of these things where I was in the right place at the right time, and it just kind of made sense to me. The electrical system of the heart made sense, and I saw there was this huge population of patients that are basically told, you can live with it. You're not going to die from it. It's no big deal. And the reality is they've hated their life. They weren't able to go skiing anymore. They weren't able, a sip of alcohol would put them in wine country is a tragedy, right? A sip of alcohol would put them into a rapid AFib. And so it's one of these things where of all the patients that I treat, and I treat lung cancer and hiatal hernias and heart, I treat everything, it seems like. But the AFib patients that get into normal rhythm are the most appreciative and happy because they feel like they've gone years with nobody really paying attention to them. So,
that's incredible.
So yeah, it's been a real treat.
So I know that you've always wanted to have, St. Helena Hospital be a destination hospital.
Yeah.
So where are you with that?
That's a great question. I think we've come a long way. I've been here for 5 years, and I initially came because St. Helena has this Kuhn Joint Institute, right? They can replace, if you break your leg, you may not want to come to the hospital, but if you need your knee replaced, it can be replaced in 45 minutes under local and you'll be walking out the next day.
I know, it's
amazing how
unbelievable.
specialized, and they do over 1,000 knee and joint hip replacements. Well,
in St. Helena?
In St. Helena.
That is staggering.
Right, and if you've never been to our hospital, you wouldn't even know where it is, right? It's up on the hill, it's tucked away. We have patients that come from a long way away, and they said, I can't even believe there's a hospital up here. Well, what they had done is they had figured out how to go out and educate the public. They would go to Redding, or they would go as far as Santa Barbara and give seminars and talk to people about, there are a lot of people walk around
robotic
with knee
surgery.
pain. And but you don't know, wait, am I supposed to, is this something that qualifies for a knee replacement? Is this just, do I get an injection? So they would go around, and I'm not an expert on this at all, so what I saw was their model of going out and educating directly to patients that weren't getting the answers from their own home doctors. So when I came, I thought, this applies to atrial fibrillation. In fact, a lot of times I think AFib and knee pain are similar. You're not going to die of a bum knee, but it can seriously affect your life if you can't get around. So, what we did is we put together, we just completely modeled our program after them. So we have a lot of patients because of our outreach education that are coming from hundreds, if not thousands of miles away. So your initial question, a destination program. What we have is a lot of infrastructure to help people get to the hospital. We can help them through partnerships with local hotels to kind of, let them know where to stay and whatnot. I am hoping that we will get to the point where we have like a Ronald McDonald House for adults.
Oh, wouldn't that be fantastic?
Yeah, where the families have a place to stay, and I think that there's a need for it because we have a lot of patients that come from far away, and as you know, it's you come during peak season to St. Helena. It's not like there's a Motel 6 sitting there.
I mean, even now,
you're going to
people
pay $500 a night, to stay in a hotel.
And you won't get I had clients complaining the last 6 weeks they can't get a hotel.
Right.
It's unbelievable.
Right. So the majority of my patients are coming from far away. What we do from a destination hospital to try to make it easy on them is make it so they don't have to come back and forth a lot. Napa Valley is beautiful. It is a great lifestyle. It's a great place to live. It's not necessarily the easiest place to get to and out of. There's not an airport right next to it or whatnot. So patients typically, if they need to have some specialized medical procedure, they're okay to go somewhere for that procedure. But they don't want to have to come for multiple preoperative visits, multiple postoperative checks. So we try to make that easy by either doing phone consults or sometimes web conferencing with patients before, and even after, we can kind of coordinate a lot of their care outside. And that just, I think, puts them at ease that they're not going to have to spend a whole lot of money and a whole lot of time just on the commuting process of it all.
Yeah. What are some of the other programs that you have been involved with at St. Helena Hospital?
Sure. Well, honestly, it's exploding, to be honest with you. It's growing every day. So the AFib program has been a big one that I got going from the beginning, but we have what we call a structural heart program, but it's mostly valvular disease of the heart. And Dr. Diva Karuni is one of our cardiologists, Dr. Allen, Dr. Sakopoulos is the other surgeon. The four of us are and Dr. John Laird, who's just come in from after being at UC Davis for a long time. That's kind of the core of our structural heart program. So we have TAVR, which is transcatheter aortic valve replacement. It's kind of a mouthful, but instead of basically having to cut somebody open to put a heart valve in, we can put it in just like a coronary stent through the groin. Now that's one of those things that's been in Europe for over 10 years. It's been in the US under trial for several years, and only recently has it become commercially available. And it used to be you only did it for patients that would never survive operations. And then you put it for patients that were moderate risk. And only recently, it's still in trial, but we're about to get to the point where even low-risk patients can get their aortic valve replaced through the groin without even having an incision. So our TAVR program is really one of the first programs outside of a big university hospital setting, in all Northern California. And, we service a lot of, like I said, Northern California. There's a lot of patients that live up in those rural areas. So a lot of times in the past, they would have to pass us to go down to UCSF or Stanford or over to UC Davis. And, we offer a little bit more ease of access to them. So the transcatheter aortic valve, and the other one is the MitraClip program, which we're just starting. UC Davis has been a kind of a pioneer in MitraClip placement, but that's what we can do for patients that have mitral regurgitation or a leaky valve. Instead of opening them up, replacing the valve, repairing it, you can go in through the groin and just put a little clip on the valve that will cut the leak, maybe not down to zero, but down substantially enough that it could really, positively affect your quality of life. Wow. A lot of people think, heart surgery is about saving your life. A lot of it has to do with making your life better, to be honest with you.
Well, what should people do? At what age should people start having their heart checked?
What
advice do you have?
That's a great question. A lot of it has to do with being aware of your family history. I say, I've got people very close to me that I know that have drank and smoked and are overweight, and they'll live to be 100 years old. And everybody in their families always lived to be 100 years old. And then there are others that are 45 and have horrible hearts because of a bad deal with the genetics.
Really?
So the most important thing is to be
genetics.
Aware of your family history. If
Right.
your parents or multiple family members have had heart disease at a young age, you should get yourself checked out at a younger age. But I think it's reasonable once you hit 50 to start, consider a stress test, consider getting your cholesterol checked, obviously making sure you know how your blood pressure runs. There are all kinds of guidelines that the cardiologists tend to focus on more than the surgeons, because by the time they come to me, they've already got the problem.
I know, that's what's so worrying. Yeah.
People come in. But to be honest with you, most people that have heart problems, once it's diagnosed, they say, oh, that's what's been going on for the last 2 or 3 years. You really have to overcome your denial more than anything.
Yeah, I absolutely think so, and particularly men, right?
Yeah, that's right. That's exactly right.
How is the Cancer Center doing?
The Cancer Center is very good. Again, I think our hospital depends on providing services that other places can't provide. So what our Cancer Center has are top-notch oncologists, top-notch radiation oncologists. Particularly in the radiation oncology world, they have some high-level technology that they can use for kind of zapping tumors in a very precise way. And our infusion center is great. The issue is you still have, people don't necessarily want to travel if there's something available in their local area. So what we have is we have a good cooperation and coordination, and we offer clinical trials that say maybe hospitals in the outer, more rural parts of the state wouldn't necessarily offer. So from a care standpoint, I think it's phenomenal. From an outreach standpoint, it can be a little bit more challenging to get people to know about it, because everybody can give a little bit of chemotherapy.
Right.
So.
Are they? It's a beautiful new building.
Absolutely.
And do you think that it's working to full capacity, or?
We definitely have room to get more patients into the Cancer Center. I think one of the bonuses, one of the things I really like about working at this hospital specifically, is the collaboration between the physicians. We have an outstanding tumor board. There's a lot of collaboration. And you don't realize that when you're a patient and you go into a hospital, you don't really know, do these doctors like each other? Do they really work well with each other? Is it just a bunch of independent private practice docs? On the one, we're mostly employed by, the medical group that works at that hospital. And it actually, I think, really helps our communication and collaboration a lot. So from my standpoint, the strength of the cancer center is the people. The weakness is our location. If you're local, outstanding. It's great. I mean, in fact, it's almost like, living on a deserted island and you have a Ferrari to drive. Right?
Oh, wow, I love that. I love that, yeah. No.
You have the car, but, you don't, it's
Right.
almost more than we need locally. And so I wish we could attract a few more people from outside.
Well, I think that's one of the wonderful things about our forefathers and our foremothers, so many people who had a lot of money here were in the business. They made a lot of donations to the hospital over the years
right.
because they wanted to have great care, which the hospital has attracted, like you and the Kuhn Institute and the wonderful doctors in the cancer center.
Yeah, I mean, I can't say enough about the community of, particularly the, Upper Valley, but certainly all of Napa Valley. The support for the hospital has been tremendous because we're able to provide technologies that you just don't see them at smaller hospitals. You see them at Stanford or UCSF or Cedars-Sinai or UCLA, but you don't see them in these smaller hospitals. So the fact that a lot of us physicians probably wouldn't be as excited. I mean, I love living in Napa Valley, but professionally, I wouldn't be as excited to come if they didn't have the tools that I needed to be able to do the job. And we have it, and not only do we have, the gear, we're constantly developing. These things that I'm talking about, MitraClips and TAVRs
Right.
and AFib surgery, and I'm really just skimming the surface. It's fun. It's a lot of fun to work in that environment.
Well, there's just been so much money here. I think when I first came, I'm pretty sure I shared the visuals for the wine auction back in 2004. I remember back in those days, all the money from the wine auction went to St. Helena Hospital.
Yeah.
But as time went on, they were raising so much money, and now they're distributing it.
I got to figure per capita at our gala, at any given, hospital gala, every hospital has to raise money for themselves. They always have benefactors and donors.
Yeah.
But, there may only be 200 people that come to our gala and $3 million raised.
It's
so when you start thinking about the
incredible.
amount of money per person that's donated, it's made a tremendous difference for us.
Oh, it's phenomenal. I think you must see that in the schools with your children too. All these school auctions, the wines that are donated and...
Well, and that's the stuff that's not even accounted for, right? We may raise $3 million at a gala, and that doesn't count the hundreds of thousands of dollars worth of wine that was on the table that was donated by these members of the community.
Yeah.
No. So it's been, it's been a real treat to kind of have that. I mean, I think all hospitals in California are under various regulations to rebuild because of earthquakes and whatnot. And, frankly, our hospital is an old building with a lot of new stuff inside of it. At some point, we'll have to build a new building also. Which,
I was going to ask you about that. I had heard rumors years ago, I think, that they were thinking about building in the future, raising money to build future.
Well, they're under mandate by, I think it's 2030. They have to have a new building. So, you think, 2030, that's coming up on us. It takes a couple of years to build a hospital. I mean, currently we're putting in some pretty phenomenal new operating rooms and cath labs that are super state of the art. And it's almost like by the time we have those up and running, we'll be building a whole new building. So on the one hand, I'm excited about it because it'll be during my professional, lifetime. On the other hand, I've been down at Stanford when they're rebuilding a new children's hospital, a new hospital. Those are some of the disruptions that you don't like, in your workplace. We're not used to having traffic, right? All of a sudden you start doing big construction projects and you start to have some of those. So, those are things we're going to have to navigate moving forward, and that's just kind of life. And my guess, I mean, certainly within the next 10 years, they're going to be building another hospital, probably up higher on the hill.
Yeah, I think they already have the lot, don't they? It's up on, it's on Deer Park Road? No, is it? No.
They own the whole hill above them.
Yeah.
And there's certainly some open land, but
phenomenal donations that have been given to them over the years, which has made it wonderful for all of us living here in Napa Valley and anybody thinking about moving to Napa Valley. We do have rock star surgeons and healthcare. Oh, without question.
Been a real treat.
Last question for you. You make olive oil, you and Bridget.
Right.
Are you selling the olive oil?
Not yet. I don't know if we ever will or not. What we do is we give it away.
You have a lot of trees. How much are you making?
We have a lot. We made about, I don't, it's so
Delicious.
funny. I'm such a neophyte in it. I don't even know how you're supposed to quantify, but we made about 50 gallons worth this year.
Oh my Lord.
Which, and I don't know, maybe I should be talking liters, right? I should get out of the English system. But 50 gallons was enough to pretty much give everybody we knew
I'm
a little sampling.
I'm sure.
And you know what's so fun about it is being able to compare, year to year. And we just planted, we doubled the size of our vineyard, or orchard, I should say, our olive orchard. And half the trees are still babies,
but they're still really producing.
Yeah. Oh, they're producing quite a bit. So I think that, the amount that we make is going to be more. And, we've just planted some vines. So, we're getting into the biz.
Okay, how much did you plant in vines?
Just about 2.5 acres. So not a huge amount, a very manageable amount. But they tell me it should be ultra premium cab, and we're certainly
I know those soils.
We're certainly right next to some
great
very
vineyards.
good vineyards.
And in fact, I think who was it across the road came and inspected that soil some years ago for Peter Parmesano and said, "This is fantastic soil."
That's right. So I'm hopeful. It's just fun to it makes you feel really part of the valley when all of a sudden you see the blessed fruit out there.
I just know that one day you two are going to have a label. I've been watching this. You're always dancing around it, looking at the vineyards, planting the vines.
The second career down the line. Once we figure once all the cardiologists put the heart surgeons out of business, and I guess I'll move to farming, which will never go away. Right.
It's been so great having you on the show. Thank you
Thanks,
so
Latife.
much for being here.
Appreciate
I
it.
really, really appreciate it.
It's been a lot of fun.
Thank you. Thank you, everybody. And I look forward to seeing you next week. Meanwhile, you can see the rest of my podcasts on latifehayson.com and my Facebook page, Latife Hayson Wine Country Properties.